afternoon, everyone, and welcome to today's PHO webinar presentation on Public Health Ontario Ethics Review and Support Services for Public Health Units information session. My name is Jo Sinaiko, and I am the Research Ethics Coordinator at Public Health Ontario. I want to take this time to recognize that I am joining you from Dundas in Hamilton, which is on the traditional territory shared between the Haudenosaunee Confederacy and the Anishinaabe Nations, which was acknowledged in the Dish with One Spoon wampum belt. That wampum uses the symbolism of a dish to represent the territory, and one spoon to represent that the people are to share the resources of the land and only take what they need. Before we begin, I will mention a few housekeeping items. To enhance the presentation experience, participant audio video has been disabled. The chat pod has been disabled to limit any distractions during the presentation. Please use the Q&A pod if you have any questions during the session. A discussion and question period will follow the presentation. If at any point during the session you experience any technical issues, please email capacitybuilding@oahpp.ca. Myself and Harula Samis, the Research Ethics Officer, will be hosting the presentation today. And we'll start the slides, Harula.
Thank you, Jo, and welcome everyone to our much anticipated information session. I would like to take a moment also to acknowledge the various public health units joining us today and representing everyone here across the province. Again, I'd like to acknowledge the various public health units being represented here today from across the province. We appreciate your continuing and ongoing interest, and we thank you all for taking the time to join us today. Since our province-wide launch in 2018, our team has been very fortunate to work with many of you over the years. We are looking forward to finally relaunching our services and collaborating with you and your units to build public health ethics review capacity across the province. This is definitely a joint effort. Finally, I would also like to acknowledge where you are all coming from and the Indigenous territories and lands that you live in and serve as part of your public health role. I truly believe, and I hope you do too, that building ethics capacity is just one of the many ways for us to support the calls to action in our path to truth and reconciliation. Now let's turn to the goals of the session. By the end of this session, we're hoping that public health unit participants will be able to describe PHO's unique ethics review framework and model, explain the various types of ethics review and capacity building support services that we offer to public health units, hopefully describe the ethics review submission and review process, and finally, we will share our current resources and tools, but also learn from you, the audience, about future ideas for education and training sessions. So we're really looking forward to finally connect with our public health unit clients today. Great, so I turn it over now to my colleague, Jo, and she will begin today's webinar by introducing our ethics services team.
All right, so I'm going to be introducing who we are. So I'll go through each of us individually. I just wanted to start first with Nancy Andrusek, who's the Director of Research and Ethics Services at Public Health Ontario. So she helps oversee the ethics services at Public Health Ontario. Myself, I'm the Ethics Office Coordinator. So I'm the primary contact for Board of Record agreements, which we'll discuss, ethics applications, and questions regarding our services. I work with public health units and the ethics board to coordinate project submission process, assign reviews, and compose review letters. I also assist with education and training sessions, such as the one that we are doing. Harula?
Thank you, Jo. And I'm Harulat Samis. I'm, as you know, the Research Ethics Officer with Public Health Ontario's Ethics Review and Support Services. My main role is to conduct what we call low-risk reviews on behalf of the ERB. You'll learn a little bit more about what those low-risk reviews are. Those are level 1 reviews, or what we call administrative reviews. I also conduct the pre-review of all submissions that come to the board. That includes validating the risk level of the project. That's our RST. I also review the submissions to ensure that they are complete and comprehensive. I oversee the development of resources and tools. I help manage and oversee the development of the education and training sessions, such as this. I am also primarily responsible for providing ethics consultations. And I'm the primary contact for the ethics consults. And I'm also the primary contact if you have any questions regarding building public health unit capacity building initiatives. On to you, Joe.
So of our ethics board as well, our chair is Elizabeth Peter. She is a professor at the Lawrence S. Bloomberg Faculty of Nursing. She's a member of the Joint Center for Bioethics. And before joining as our chair, she was the chair of the Health Sciences RAB at the University of Toronto. And she has an interdisciplinary background in nursing, philosophy, and bioethics. So our office, the PHO Ethics Service Team, provides administrative support to the Ethics Review Board. The board conducts reviews on behalf of PHO and the public health units. However, it is independent in decision-making and in its operations. We are a TCPS compliant board, which means we meet the criteria in the Tri-Council Policy Statement, a joint document produced by the 3 funding agencies, Canadian Institute of Health Research, Natural Science and Engineering Research Council of Canada, and Social Science and Humanities Research Council of Canada, which lays out the ethical guidelines for conducting research in Canada. So as an eligible institution that receives federal research funding, Public Health Ontario is required to have a TCPS2 compliant board. For board membership, we currently have 16 board members. They are selected from a variety of organizational settings, including public health units, academic institutions, and non-affiliated community representatives. ERB members represent a range of methodological expertise in public health, including laboratory research, epidemiology, and qualitative research, and have content area specialization, such as health promotion, infectious disease, emergency preparedness, ethics, and law. For more information about the board, including a list of our current board members, please visit our Ethics Review Board webpage, and you can find the link in the chat pod. So Harula is going to lead the next part on our ethics review framework and model.
Thank you, Joe. And as Joe mentioned, we're just going to take a little bit of time to talk about PHO's ethics review framework and model before we delve into the types of ethics services and support services that we offer. Some of you might already be familiar with our model, but we're going to take a bit of time just to give you a bit of an overview. Before we describe PHO's ethics review model, let's first discuss some of the limitations associated with the traditional research ethics review model set out by the TCPS2, Canada's leading research ethics guidelines. As some of you might know, and as Joe mentioned, the TCPS2 was created to guide the ethics review of federally funded research projects. Researchers that receive federal funding for projects involving humans are required to receive a TCPS2 compliant review as a condition of that funding. And this is why PHO has a TCPS2 board, because we're an eligible institution. I'd like to make a note that the TCPS2 has recently been updated. There's a new version, the TCPS2 2022. There's a link there. This replaces the TCPS2 2018, and I encourage all of you to take a look at the overview of some of the updates that they've made. Most notably, the updates on multidisciplinary or multi-jurisdictional research. In addition to the TCPS2 framework updates, there's also the TCPS2 course and certificate that's been updated. This is important to know as project leads are required to submit their certificate of completion with their ERB submission to PHO's Ethics Review Board. If you've already done that, you don't have to submit it to us. This is for anyone who is considering to submit a project in the future. So applying the TCPS2 within the public health context can be challenging, and this is why we created our framework. As you can see, the traditional approach to research ethics review really focuses on asking the question, is a project research or not? And as you can imagine, trying to determine whether something is research is very difficult, and there have been many attempts to elucidate the differences between research and non-research. What this model doesn't recognize is that the other non-research evidence generating initiatives, which are common in our public health context, are exempt from ethics review, even though they present risks to participants in communities. And in some cases, what we've seen is that they may present even higher risks. We've seen some program evaluation projects that could be higher risk than a research project that might be looking at analyzing existing data, for example. Secondly, non-research related projects such as program evaluation, quality improvement, enhanced surveillance, are increasing in volume and complexity within the public health context. And the current research ethics model cannot account for these types of projects and their complexity. Like research, these other evidence generating initiatives that you're all familiar with involve the systematic collection of information to add to current knowledge and to inform public health policy and program planning. But as you can see, many of these other activities use similar methods such as surveys, data analysis, interviews, and focus groups. And like research, they can all involve risks to participants and others for the benefit of the larger community and society. And so research ethics principles can be similarly applied to ensure these other activities are carried out in an ethical manner. So this is why we created the framework. In response to these ongoing issues, PHO developed a new framework for the ethical conduct of public health evidence generating initiatives. PHO's approach is summarized in this document shown here to my left, and also in a journal article, What Makes Public Health Studies Ethical? And these two documents can be found on our website, and I believe they were also sent to you with the email invitation. The framework essentially supplements the TCPS2. This is why we call it TCPS2 Plus. So what that means is that it still meets the requirements of relevant laws and policies, but what it really adds is that we're able to review all evidence generating initiatives, and they all can receive ethical scrutiny proportionate to risk. So our model is really risk-based. It's a risk-based approach, regardless of the type of evidence generating initiative. We also focus on, or try to focus on, emphasizing ethical integrity. What should I do? What can I do or should I do when I'm dealing with the communities that I serve, as opposed to compliance? What do I have to do to just get my project to move forward? And lastly, and more importantly, our framework incorporates a population and public health perspective. For example, concepts such as social justice, equity, reciprocity, giving back to our communities, and solidarity are emphasized, as well as the importance of community engagement with the communities that public health units serve. So there's some extra attention really on that public health aspect. To apply this framework, PHO developed what we call the risk screening tool, which is a self-administered web-based tool consisting of 20 primary questions. Not only does the tool promote ethical reflection during project planning, it systematically identifies the potential risks of a project by assigning a fixed risk level to each question, ranging, as you can see, from 0 to 3. Once completed, the RST identifies 4 levels of review. Levels 2 and 3 on our right here at the bottom, which correspond to the delegated and full board levels that are standard to most research ethics boards, as well as 2 additional levels, levels 0 and 1, which expedite the review of what we call low-risk projects. Please keep in mind that the tool does not replace a formal ethics review. It only provides a risk level to help assign a level of review. The tool can be accessed through our website and also by following the link. We have it in the chat pod below. We can now turn to PHO's ethics review and support services, which you've all been waiting for. So now that you get a sense of who we are and the framework that drives our services, we're going to give you a bit of an overview of the two core service functions that we provide. So PHO's ethics review and support services provide 2 core types of services. The first one being our ethics review and oversight services. In general, that's the fact that we provide TCPS2 compliant reviews to all evidence generating projects. Again, that's what makes us different from other ethics review boards. And we also provide capacity building and support services, which we're going to talk in more detail soon. So when should you use PHO's ethics services? Before we get into the types of services, when should you contact us? And when should you involve us in your project? You could from the slide here, we're available throughout the life cycle of your project. And these are the types of services that we provide. From project planning, we can provide ethics consultations on the types of recruitment and consent processes that you might be considering for your project. We also help you identify project risks and mitigation strategies. We can also support you during the ethics submission of your project. For example, we're here to support you to help you fill out the ERB application, help you complete the RST, as well as validate the RST. If you're interested in knowing for sure what the level of review your project is, we can help you validate the RST. We're also here to support you in helping you understand the whole ethics review process, the submission, continuing review, and closure. During the implementation of your project, we're here to support you with annual renewals, amendments or changes to your protocol and project, as well as unanticipated or adverse events. Finally, we're also here to support you during the closure of your project. Let's now hear from Jo, my colleague, and she will walk you through the ethics review and oversight services that we offer.
Right, so the PHO ERB, Ethics Review Board, provides TCPS2 compliant review of any evidence-generating projects with a validated level 2 and 3 RST score. So for public health units, we sometimes review level 1 projects and administrative projects if it's a case where they require TCPS ethics review. So this could be because of a sponsor or funder requirement, like the LDCP funding or funding from the Tri-Council organizations, or it might be a privacy requirement, such as Section 44 in PHIPA. However, this is a very important part. Before a project can be submitted to Public Health Ontario for review, the Public Health Unit must have an existing Board of Record agreement, we call a BOR, with our ethics board. So the BOR is an overarching agreement that's signed once and applies only to projects that health units submit to PHO for review. So once the Board of Record agreement is signed, it's use of our board for any given project is completely optional, and it's the public health unit that decides which projects are submitted based on their own policies. So for a list of public health units with a BOR, you can visit our external website. There should also be a link in the chat pod. As a note, Renfrew County and District Health Unit recently joined, and they aren't on the list yet. I will make sure it gets updated. And if your unit isn't listed, but you think our services sound valuable for your unit, setting up a BOR is very easy, so just reach out to us at ethics@oehpp.ca. And another important thing to understand if you're working with other health units and you're doing a project that you think would benefit from ethics review. So if there's multiple health units working together on a project, we can provide a centralized ethics review process. So rather than engaging multiple ethics boards, we can provide a single review. So there can be units in a multi-site project without BORs, but our approval extends to those that have a BOR and who have assigned us as their board for the review. So that step is still included, and I'll discuss that soon. If you want more information, we have an FAQ that's accessible through our website. And for the next stage, Harula will discuss our capacity building and support services.
Great, thank you, Joe. Regarding the second core function of our services, as part of our capacity building initiatives, public health units are encouraged to assign what we call ethics designates when signing a BOR agreement or Board of Record agreement. The ethics designates role is still evolving, and it's very flexible and really will depend on the public health unit's capacity and service needs. There are certain expectations of the role, but again, these aren't requirements. We understand that every public health unit varies in their capacity, and we're not making this a requirement, but we do see the ethics designate role really centering on being a liaison between PHO ethics services and their unit. They're also supportive in coordinating the BOR agreement execution, so helping execute the BOR agreement. They're also very key in helping with the facilitating the implementation and uptake of our services, letting their public health unit staff know that you do have a BOR agreement, that you can use PHO's ethics review services, as well as helping units decide which projects come to our board. Some units might say only level 3 high-risk projects should only come to PHO. Others are okay with using level 2 and 3 projects. We also want the ethics designates to be a part of our capacity building initiatives. We are going to start or relaunch our ethics designate forums. There was a period where we couldn't do them for a while during the pandemic, but we are in the process of starting to relaunch those early next year. And we're hoping to build a community of practice with all the public health units using our services in order to achieve capacity building across the province. Another key important aspect of our capacity building initiatives, again, is our one-on-one ethics consultations on project-related items. Again, this is about your projects that we can help support. Examples include support with completing the risk screening tool, the ERB application, any consent and capacity issues, ethical recruitment strategies that you're thinking of. When is community engagement required when sending a project to our ethics review board, as well as helping with determining some community engagement plans, as well as just generally identifying the risks and some of the mitigation strategies. So you can send your inquiries to ethics@oehpp.ca, and we can set up a meeting, and we can support you with any of these project-related items. Finally, we're really here to help support, again, the capacity in the assessment of ethical risks and review of low-risk projects. Our board really just focuses on helping public health units with the review of level 2 and 3 projects, but what we really want is to support units in reviewing the more low-risk projects, most notably the level 1 projects. So we're here again to help support you with maybe the co-review of low-risk projects, helping you in supporting you in reviewing those, providing you advice on some internal review processes or standard operating procedures that you might have for the review of low-risk projects. We are, once again, helping with the coordination of an ethics designate forum and community practice to learn from each other and how other public health units are tackling the review of low-risk projects. And we also have access to resources and tools for the review of low-risk projects that you can access by contacting us directly, and we can share them with you. Also, the ethics designates will be able to access these low-risk review documents or guidelines or tools through our new and revamped collaboration site, which is again going to happen in early next year. You can find more information about this in the coming months when we have our ethics designate forum for the ethics designates. Finally, in terms of capacity development, this is just an overview of all our resources that are available on our website. There's a link to in the chat pod where you can find most of these resources. As you can see, there's the risk screening tool, our framework, our multi-jurisdictional review FAQ, harmonized forms. What we mean by harmonized is that we develop these forms during the pilot of our survey of our services with public health units. So they are very much collaborative forms that we developed with public health units. We also have our new consent form guidelines and templates that that units are required to use when submitting any consent forms to the board. And we're going to have a whole list of new resources coming soon. Again, check our website for available resources, and we will also send out a reminder through email to everyone and through your ethics designate. You can find all these resources again on our website, and there's a link in the chat pod. So on to you, Joe, for giving us an overview of PHO's ethics submission and review process.
All right, so the most important resource for doing an ethics application is our ethics services website. It has information on how to submit an application, includes the submission deadlines and meeting dates for level 3 projects, and has our tools, resources, and forms. And you can find a link in the chat pod for your reference. And so there are several important parts of the submission process, which is good to understand so that you can have the easiest time submitting your project and getting the review done in your timelines. First, there's making sure you have a complete and comprehensive ERB application. Second, your methodological and privacy review sections are addressed in full. And third, having the proper organizational approvals for your project. So right now, Harula will speak to having a complete application.
Thank you, Joe. And so this is just a visual to help you understand what we're looking for and what the submission process in a nutshell kind of looks like. So on the far left, you see completion of an application involves many parts. There's the ERB application and project materials. There's the request to appoint form that Joe's going to talk about. That's where you appoint us as the board for that specific project. That's at the back of your ERB application at the very last page. We also require the lead to submit their TCPS2 certificate. Again, if you've done that already, no need to do it again, as well as a completed RST so that we know where to assign your level of review. Finally, once you submit it into PHO, once you've submitted, there is another process that happens. This is the process where we do our completeness and quality check to ensure that your project is complete and that it's been all the necessary questions have been filled out. You have all of your consent forms and recruitment materials. You'd be surprised how many times we've seen submissions where they forgot the consent form, for example, or it just didn't meet the when they were in the process of PDFing the whole thing, it didn't get in there. So we do a completeness and quality check to make sure that the protocol and application is ready for review. We also validate the RST. Sometimes a project might come in as a 3. When we validate it, we realize it actually might be a 2, and vice versa. Finally, once we do our completeness and quality check, we then submit it for review to the ethics board or the ethics board delegates. Now Joe's going to talk a little bit more about what we mean by completeness and quality checks, especially methodological review.
Right. So in the ERB application, question E2 of the application form asks, has the project undergone a scientific or methodological quality review? So the methodological review should be conducted by either an individual at your unit with relevant methodological knowledge and experience who is separate from the project team, or if it goes through a competitive review and approval process, such as the LDCP, we accept that as methodological review. Or if you have an internal PHU review committee that goes over this sort of question, then we can accept that. Also, if your unit isn't able to meet any of these requirements, but you wish to submit an ERB application, then public health units are encouraged to contact PHO's evaluation and knowledge mobilization team for evaluation support services at evaluate@oahpp.ca. So in this instance, the scope of their services is limited to ERB application development, where they help you with this aspect of the project, but it doesn't extend to supporting the implementation of your project. The other question that often comes up is around privacy review, which is question E3, which asks, has this project undergone a privacy review? So Public Health Ontario has a privacy department that does all of our privacy reviews for our projects. We understand that's not the case at most units. Instead, it's that we're expecting that you are going to follow your internal policies regarding whether there is privacy review or not. And this needs to be explained in the ERB application form. And then if you are working with external vendors or services, then those agreements will also have privacy aspects that you should explain and that are included in the application. An important part of this as well is you're explaining it to us in your ERB application form. We also expect that you explain this in your consent process as appropriate, right? So it should be built into your consent as well. And this has come up a couple of times, the request to appoint form. So before we talked about the Board of Record agreement and how it makes it so that the unit can assign projects to our board for review. And so that's what this request to appoint form is. So it's a key component to submitting a quality application, and it counts as institutional approval and support. So it's found on the last page of the application form. It's signed by someone with signing authority for the unit, which is the same requirement as a Board of Record, but it doesn't have to be the same person. It names PHO's ERB as the Board of Record for the project. It confirms that the public health unit considers the project to be feasible and methodologically sound. And it also obligates the unit to our decisions and continuing review requirements for the project. And ideally, but again, not required, is that an ethics designate is able to support the applicant through this particular process. All right. So, and also another very popular question. So how long do reviews take? So first of all, when a project is complete, and it goes to reviewers who provide comments. And then those comments go into a review letter that's then sent to the applicant. So the timeline on this slide describes how long it takes to receive the first review letter, not the approval. So for a level 2 delegated review, once the RST is validated and we know for sure it's a level 2, it usually takes 3 to 4 weeks from when the complete application with the validated RST is received. For a level 3 full board review, on our website, we have our submission deadlines that are 4 weeks out from the board meeting. So the submission deadline from there, it's 4 weeks till the board meeting plus 1 week for the review letter, so 5 weeks in total. And then an important thing to note is that level 3s are tied to single monthly board meeting dates. And if the project is submitted at the deadline, but it's not complete or ready to review at that deadline, then it will be scheduled for the next month's board meeting. So this is, again, timelines to the review letter. The timeline to final approval depends on how long it takes the applicant to respond to the review letter and how many rounds of comments are needed. So if the response takes 2 weeks, we review the response. That could mean it gets approved, or there could be more comments that then get sent back and until the approval. So there's a lot of variables, which is very important to keep in mind with your timelines, and that our timelines start from a fully complete ERB application form, not necessarily the first version that's submitted. All right, so now we will move into the question and answer segment of this event to address some of your questions.
Okay, looks like we've got our first question. Do you need a peer review regardless of your risk level? Correct. Not a peer review, but what we call methodological review, and there's different ways that you can achieve that. So usually for level 2s and 3s coming for the board, yes, you do need to meet that methodological review requirement. Okay, we have a few here. Sandy, does the PHO ERB has some limit on the total number? Nope, we do not have a limit currently at this time. But having said that, be mindful that as capacity grows and we're still a small group, we might need to initiate some limits. But at this moment in time, there are no limits on the number of projects that you can submit to the board. On a next question, when speaking of consent, do you mean consent of participants? Correct. We're talking about any questions that you have regarding consent and capacity of the potential participants that you are trying to recruit for your study. Next question, can you give examples of risk 1 versus risk 2 projects? It depends. That's a very difficult question to answer right away, but usually level 1 questions, you're not, for example, I could tell you off the bat, you're not asking personal questions or personal health questions. Those are more of the risky questions that we see. Level 1 projects normally are questions about one's professional opinions about a particular topic, for example, but you're still asking someone to talk about, let's say, risks and barriers. So there is some level of risk, but those are usually the level ones that we see, the more professional ones. Next question from, will you publicly share how many applications you receive each month or quarter? Good question. We're planning to do that next fiscal, is have a yearly report, hopefully or an annual report that will go over a lot of those numbers. But yes, good question. Thank you. For the next question was a compliment as well. Is there a backlog waiting list for completed applications being reviewed by the ERB? Nope. We don't usually have a backlog. We're pretty, right, Joe? Maybe you can address this one. Is there a maximum number of proposals that are reviewed at each monthly meeting? Good question. Joe, take it away.
The most we've had is 2. That involves 4 board members. If we go beyond that, it becomes a question of capacity of the board to keep reviewing them. So we haven't had this happen yet, but it's possible that if we have too many applications all at the same time, that we might need to address that in some way, especially if it happens more than once, but that hasn't been an issue so far.
Great, thank you. Next question from you showed 4 levels for PHO, that's right, 4 list grant levels. Do the level 2 delegated and level 3 full review correspond to your 3 and 4? Correct, yes. So our risk levels correspond to the type of level review, right? So delegated level 2 and full board is level 3. Joe, do you want to take the request to appoint form? Next question.
The request to appoint form is definitely a requirement for level 2 and 3. I think because internally to PHO, we don't require it for level 1s, but I think we would actually require it for lower risk projects. Just because it's like a contractual agreement between the unit and PHO that this project has been assigned to us for review. And so if someone sent us something without that, we don't have the ability to know if the unit itself has sent this or just someone sending us things. So we do require that, regardless of the risk level.
Great, thank you. And next question, can you provide more information about your risk screening tool? Yes, sure. What is the weighting, the scoring system for each question? Yeah, sure. Why are we trying to develop our own tool? Okay, yeah, there is there's the journal that was published, the journal article that was sent with the invitation gives you a bit of a bigger overview of the risk screening tool and how it was developed. But you can definitely schedule a meeting with us, with Joe and myself, and we can walk you through the back end of the tool and how things are weighted or scored. Just to let you know, the tool was developed with a group of public health professionals and ethicists that assigned a risk level for each response to the risk screening tool. But happy to discuss with you in more detail how it was developed and how we can help you inform your own tool. So reach out for sure. Our consultation service is available if you do not proceed with it. Of course, yes. So you can use our consultation and support services and never use our ethics review services. Both services are available to all units, and you do not need a board of record agreement for our consultation services. Excellent question. Do you have any guidelines, templates for creating consent forms? Yes. It's posted on our website. It's our consent and guideline document. It's a very thorough, detailed document that can guide you through the entire process of developing consent forms. You can access it on our website. And again, it was, I believe we had a link to it in our chat pod as well. Next question, wondering if there is an evaluation plan template that you would want us to use. This could help us know what you're looking for. Perfect. Good question. I really do encourage you to reach out to our evaluation support team here at PHO at evaluate@oahpp.ca. Maybe they have a template that they can share with you. But you can also refer to the ERB application because it really gives you a good sort of overview of the different steps of your protocol. But I understand what you're saying in terms of like a real evaluation protocol needs its own template. I really encourage you though to connect with our evaluation team here at PHO, and they can support you with that. And we can connect you as well if you'd like to set up a meeting with us, and we'll make that connection for you. Oh, Joe, I'll let you deal with the privacy question for up next at the top.
Right. So asking about how units will have different policies and process. So we don't dictate how the unit deals with these things. I mean, everyone has their legislative requirements and all of that. If units are looking for information about privacy, we aren't experts on that. So if your unit has access to a privacy consultant or someone who's able to provide more help with that if you're unsure. We encourage that, but we do not consider ourselves privacy experts, so we wouldn't, be consulting on that sort of question. And then the next one, Hurla, I think speaks to you. Examples of consultation type questions you receive.
Yeah, sure. And it ranges really from I need support in obtaining consent from adolescents for a sexual health project. What and do I need parental consent as well? Other questions are do I need community engagement? To what extent? So it ranges on project specific issues, but I also have been involved in giving my advice on an entire project, but it wasn't, let's say, subject to ethics review. So it wasn't a formal review, but I did provide, for example, a really thorough analysis of what I thought some of the ethical risks were. This was like, for example, an enhanced surveillance program that we didn't think needed to come for ethics review, but I did meet with the public health unit many times, and we were able to really work out the ethical implications of what they were doing. So it really ranges. I've never said no to any ethics consult. So if you're willing to challenge me, go ahead, send us an email, and we're here to help as much as we can.
Yeah. So as we wrap up today's webinar, I'd like to thank everyone who joined us today. You can expect to receive a brief and anonymous survey for today's session. Please try to complete this to help us improve our programming. As a reminder to everyone to save the date, topic, the Ontario Public Health Convention will be held on March 26th and April 3rd in 2024. So check out tophc.ca for details. Lastly, to access past presentations and view confirmed upcoming sessions, please visit the PHO website, head to Education and Events, and click on Presentations. Thank you all, and have a wonderful day.